Imagine you wake up on an ordinary morning, take your first step out of bed and feel a sharp twinge in your knee, as if something inside suddenly swelled. You try to walk, but every movement feels heavier, stiffer, and more painful. That fluid building up inside your joint doesn't just limit your steps. It steals your independence, drains your energy, and slowly chips away at your confidence to move. I'm Dr. Tomas, and today I want to talk to you about a silent enemy that affects millions of people over the age of 60, knee inflammation. Many believe this condition is irreversible, but the truth is that it can improve significantly with something simple and natural, the right kind of movement. I've worked with patients who could barely step up a stair and, with guidance and persistence, completely regained mobility. Without relying on medication or surgery, just through targeted exercises and consistency. The key lies in understanding that the body has a natural drainage system. When the right muscles are activated the right way, they help eliminate excess fluid buildup and reduce the internal pressure that causes pain. And that's exactly what we're going to explore in this video. 5 specific, safe, and age-adaptable exercises that reduce knee swelling and drain the fluid that's keeping you from walking freely and confidently. These are simple movements that you can do at home, with no equipment, no discomfort, and visible results in just a few days. Stay with me until the end, because the last exercise includes a little-known but highly effective drainage technique, one that can restore lightness to your steps and comfort to your joints. Remember, the knee is one of the most complex, and also one of the most overworked joints in the body. Every step you take, every movement you make, every time you go up or down stairs, it all puts pressure on your knees. As the years go by, the body's natural wear and tear begins to show. Cartilage starts to deteriorate, muscles lose strength, and circulation slows down. That's when a silent enemy appears, the buildup of synovial fluid. This fluid, which under normal conditions helps lubricate and protect the joint, begins to accumulate excessively, causing internal pressure, inflammation, and pain. This condition is known as joint effusion, and while it isn't always a sign of a serious illness, it's a clear warning from the body that something isn't working properly. It can be caused by repetitive micro-traumas, excess weight, osteoarthritis, or even the habit of sitting for long periods. When fluid builds up, the knee loses mobility, feels warm to the touch, and even the simplest tasks, like standing up from a chair or walking a few feet, become a real challenge. That's why the most effective treatment starts with movement. But not just any movement. We're talking about smart movement. Specific exercises that activate the calves, quadriceps, and deep muscles of the leg. These muscles are the real engines of the body's natural drainage system. When activated, they promote venous return, reduce internal joint pressure, and improve cartilage nutrition, strengthening the structures that support and protect the knee. Before you consider injections, anti-inflammatories, or surgery, try practicing the guided exercises I'll show you with consistency. They are the first step to regaining the freedom of your joints and moving again without fear or pain. Let's start with the first exercise, called supported leg elevation. It's a simple but highly effective technique for reducing knee swelling and eliminating excess fluid buildup. The main goal is to activate venous and lymphatic circulation throughout the leg, promoting the natural return of fluids to the heart. This practice combines 2 fundamental principles: elevation and gentle muscle contraction. Find a comfortable place where you can lie on your back. This can be on a bed or a mat. Place your legs on the seat of a chair or on the couch, so they are slightly elevated above your heart. This simple position already begins to work in your favor, as it uses gravity to help drain the accumulated inflammatory fluid. But don't stop there. Next, perform a controlled movement. Slowly bring the tips of your toes toward you, then push them downward, alternating in a smooth and continuous rhythm. This action activates the foot and calf muscles, which act like a natural pump, pushing the blood and retained fluids back to the heart. It may seem like a simple movement, but there's a lot of science behind it. When you contract the calf muscles, you compress the deep veins, facilitating venous return and helping to eliminate the inflammatory fluid responsible for pain and swelling. Do 25 repetitions with each leg, taking short breaks between sets. If you feel a slight tingling or warmth in your legs, that's a good sign. It means your circulation is being reactivated and your body has begun its natural drainage and healing process. Breathe deeply and synchronize each movement with your breathing. Inhale as you pull your foot towards you, and exhale as you lower it. This breathing rhythm helps relax the muscles and improve blood flow. After a few sessions, you'll start to notice that the heaviness in your legs decreases and your knees feel lighter, less swollen, and freer to move. This exercise is perfect to start your daily routine and can also be done at the end of the day, especially when your legs are tired or heavy. And remember, if you already feel some relief after finishing this first exercise, wait for the next one. It will work directly on the knee joint, stimulating drainage from the inside out. Now let's move on to exercise 2, stretch with elevated knee. This movement was designed to help shift the fluid accumulated inside the joint and restore knee mobility without causing pain or strain. It's a gentle, therapeutic, and highly effective exercise for anyone experiencing stiffness, inflammation, or that constant feeling of internal pressure. To perform it, lie on your back, just like in the previous exercise. Bend one leg, keeping the foot flat on the floor, and extend the other leg upward toward the ceiling. Gently hold the back of your thigh with both hands. If it's hard to reach, use a towel or resistance band to assist the movement and maintain the position effortlessly. From this position, slowly straighten the leg upward. Without forcing, go only to the point where you feel a stretch, but no pain, and then relax. While stretching, pull the toes toward you. By doing this, you activate the entire posterior muscle chain, calves, hamstrings, and the muscles around the knee. This muscle activation is essential to reactivate circulation and encourage the body to naturally eliminate the inflammatory fluid. Do 10 to 15 repetitions per leg, holding each stretch for 3 to 5 seconds. Throughout the exercise, keep your abdomen slightly engaged and continue breathing deeply and in a controlled manner. Inhale as you extend, exhale as you relax. If you feel slight muscle tension, that's normal and even desirable. It means the muscle is being properly activated. But if you feel sharp pain or intense discomfort, stop immediately and reduce the movement angle. The goal is to work with your body, not against it, always respecting your limits. This exercise not only helps eliminate inflammatory fluid, but also restores joint mobility lost due to lack of use or prolonged rest. In just a few days, you'll notice your knee bends more easily, movements become smoother, and the tension around the joint visibly decreases. And remember, the goal isn't to lift your leg higher, but to perform the movement with control and consistency, always respecting your body's limits. In the next exercise, we're going to activate the muscle that most protects your knee, and which you've likely not used in years. This is exercise 3, isometric quadriceps contraction. Without exaggeration, this is one of the most important exercises for reducing inflammation and preventing fluid buildup in the knee. Although it may seem simple, it's an extremely powerful therapeutic tool. Its goal is to strengthen the quadriceps, the main stabilizing muscle of the knee, without needing to move the joint, which is essential when there is pain or inflammation. To begin, find a comfortable position. You can sit on a firm surface or lie down with your leg extended in front of you. Place a rolled towel under your knee to provide support and make the exercise easier. Now comes the most important part. Gently press your knee down against the towel as if you're trying to push it into the floor. Hold the contraction for about 5 seconds, then slowly relax. During the contraction, you'll notice your thigh muscle becomes firm. This is the sign that your quadriceps is being properly activated. This type of contraction is called isometric because the muscle contracts without changing its length and without creating joint movement. This allows you to strengthen the knee without impact, pain, or worsening the inflammation. In addition, alternating between tensing and relaxing stimulates blood circulation within the muscle, which helps pump retained fluid out of the joint and improves oxygenation of the surrounding tissues. This work also reinforces knee stability, reduces pressure on the kneecap, and relieves discomfort. Perform 3 sets of 10 repetitions per leg, keeping your breathing deep and controlled. Inhale as you prepare to press, and exhale as you contract the muscle. If you'd like to slightly increase the intensity, you can place a small weight on your thigh. A bag of rice, a sandbag, or even a light gym weight. The most important thing is to maintain tension without pain. If you notice the knee starting to warm up, or the feeling of heaviness decreasing after the exercise, that's a sign it's working. The muscle is supporting the natural drainage process. With daily practice, this technique restores firmness to the quadriceps, improves balance and stability while walking, and significantly reduces the risk of future fluid buildup or inflammation in the knee. This is exercise 4, straight leg raise, one of the most complete and effective movements for strengthening the muscles surrounding the knee and helping the body naturally reabsorb accumulated inflammatory fluid. Although it may seem simple, it brings together 3 powerful elements: strength, control, and circulatory stimulation, all in one movement. It's the natural progression after isometric contractions, as it takes the work of the quadriceps to a more functional level, impact-free and completely safe. To start, lie on your back on a firm surface, like a mat or exercise mat. Bend one leg, keeping the foot flat on the floor, and keep the other leg fully extended. The toes of the extended leg should point upward, which already activates the front leg muscles and prepares the knee for the effort. Next, slowly raise the straight leg until it reaches the height of the bent knee. Keep your core engaged, your back supported, and the movement controlled. Hold the top position for 3 to 5 seconds, then lower the leg slowly and with control. Don't let it drop. This detail is crucial. The downward motion is what activates the stabilizing muscles and stimulates lymphatic drainage of the joint. Perform 3 sets of 10 to 12 repetitions per leg, alternating between them. If you want to increase the intensity a bit, you can place a rolled towel or a small weight, like a light ankle weight or a bag of rice, on your ankle. This increases resistance without compromising the safety of the movement. Throughout the entire exercise, maintain a steady, rhythmic breathing pattern. Inhale as you lift, exhale as you lower. If you feel mild tension in your thigh muscle or a gentle warmth around your knee, that's a great sign. It means the exercise is working and circulation is being reactivated. The straight leg raise not only strengthens the quadriceps, but also activates the hip flexors and improves overall leg stability. This helps prevent the knee from becoming overloaded during everyday activities like walking, climbing stairs, or getting up from a chair. Additionally, the elevated position facilitates venous return, helping the body eliminate retained fluids and reducing the feeling of swelling. With regular daily practice, you'll notice improvements in strength, balance, and confidence when moving. And if your knee already feels lighter and less stiff after this exercise, don't stop here. The next movement is the final step, combining massage and mobility to complete the drainage process and relieve inflammation in a deep and lasting way. Exercise 5, self-massage and patella, kneecap, mobilization. This final exercise is the perfect complement to enhance the drainage of synovial fluid and restore the knee joint's natural mobility. Called self-massage and patella mobilization, its goal is to reactivate local circulation, reduce internal pressure, and release small adhesions that restrict joint movement. It's a restorative exercise that not only relieves physical discomfort, but also promotes a general sense of relaxation and reconnection with your body. This is a simple technique, but it requires attention and gentleness, as it works directly on a sensitive and often inflamed area. Start by sitting on a firm surface with your leg fully extended and relaxed. Place your hands on the sides of your knee with your thumbs positioned just below the kneecap. Begin with gentle circular massages, lightly moving the skin and superficial tissues with slow, controlled motions. Breathe deeply while doing this. Conscious breathing helps release muscle tension and promotes relaxation of the joint. This initial contact warms up the area and stimulates the flow of oxygenated blood, preparing the knee for the next step. Then, use your fingertips to make upward movements, sliding from the shin toward the thigh, as if pushing the retained fluid toward the heart. Apply moderate pressure and keep this motion going for 1 to 2 minutes. This helps stimulate the lymphatic system, reduce swelling, and activate the body's natural drainage process. The more regular the practice, the more efficient circulation in the area becomes. Next, move on to the patella mobilization phase. With the legs still relaxed, gently hold the kneecap between your thumbs and index fingers and begin to move it slightly, up, down, and side to side. The movement should be small, controlled, and painless, just a few millimeters. This procedure helps release adhered synovial tissue, allowing the fluid inside the joint to distribute more evenly and helping the knee regain its natural movement fluidity. If you feel slight pops, small vibrations, or a release sensation during the mobilization, don't worry. This is a sign that the joint capsule is regaining flexibility and internal mobility. To finish, apply a broad, enveloping massage using the palms of your hands, making large circular motions that cover the entire knee area. If you want to enhance the benefits, use a light oil or cream with arnica, known for its anti-inflammatory and relaxing properties. The warmth of your hands, combined with the continuous movement, improves oxygenation, increases tissue elasticity, and provides a deep sense of relief. Practice this self-massage daily for 3 to 5 minutes, preferably after the previous exercises, when the muscles are already warm and circulation is more active. In just a few days, you'll feel less stiffness, more lightness, and greater freedom of movement. The sensation of mild warmth and relaxation after the practice is a sign that blood flow is being restored and the body is eliminating excess retained fluid. Remember, the key isn't to apply force, but to listen to your body and act with gentleness and precision. This final gesture not only reduces inflammation, but also creates a conscious connection between your hands and your own health, something we often forget in the rush of everyday life. By touching your own knee, you send a signal of care and attention that has a real effect on the nervous system, helping reduce stress and physical discomfort. And before starting any knee rehabilitation routine, it's essential to understand that not all joint pain has the same cause. That's why the first step should always be to seek the evaluation of a professional who can identify the exact cause of the problem and guide treatment in a safe, personalized, and lasting way. If your knee shows intense heat, redness, or fever, this may be a sign of infection or a more serious inflammatory process that requires immediate medical attention. In such cases, it's essential to seek a professional as soon as possible to avoid complications. However, if your doctor has already ruled out more serious causes and confirmed that it is a mild inflammation, osteoarthritis, or buildup of synovial fluid, then the exercises presented so far will be your best allies in recovery. Even so, they should be done with caution and respect for your body's limits. During the practice, always monitor your pain level using a 0 to 10 scale. If the discomfort exceeds level 4, stop the exercise, rest, and apply a cold compress for 10 to 15 minutes to reduce inflammation. A mild feeling of tension or warmth is normal, but sharp pain is a warning sign that your body is asking for a break. And most importantly, if swelling or pain lasts for more than 2 weeks, return to your doctor or physical therapist. Consistency and prevention are the best tools for having healthy, fluid-free knees. Remember something essential. Your knees are not failing. They're communicating with you. Every twinge, every stiffness is your body's way of asking for attention, movement, and care. The good news is that it's never too late to turn things around. With patience, discipline, and the right exercises, it's possible to regain lightness, stability, and confidence while walking. I've seen countless patients go from being afraid to move to the joy of climbing stairs again, walking without pain, and even dancing once more. The secret lies in listening to your body, acting consistently, and remembering that every step you take is a step toward movement freedom and long-lasting joint health. Walking in the park again, feeling the wind on your face, regaining that sense of lightness and vitality. This is what many of my patients rediscovered by following this simple routine. It all started with something small but powerful. These 5 exercises. You don't need immense strength, expensive machines, or youth to begin. All you need is commitment to yourself and the willingness to move a little every day. Remember, the knee doesn't recover with eternal rest, but with smart and controlled movement. Every time you practice this sequence, you're strengthening the muscles that support your joint, improving circulation, draining inflammation, and restoring your body's natural balance. It's a gradual process, but every small step counts. Even if it feels slow at first, the body responds. Because the body always wants to heal, it just needs you to give it the chance. These exercises are more than just a physical routine. They're an invitation to return to movement with awareness, to regain the confidence to walk without fear, and to realize that there is still a lot of strength and vitality within you, no matter your age. With each session, you're not only taking care of your knee, but also renewing your energy and your enthusiasm for life. If this video was helpful to you, leave a like, subscribe to the channel, and share it with someone who also needs to regain their mobility and independence. Sometimes, a simple gesture can transform someone else's life. I'm Dr. Tomas, and my mission is to be by your side on this journey of health and rehabilitation, helping you walk with strength, without pain, and with the freedom you deserve, at any age. Take care of your knees with patience, practice consistently, and remember, every movement is a step toward a more active, balanced, and fulfilling life.